Managing insulin doses in type 1 diabetes is all about precision and observation. Regular blood glucose checks, at least 4 times a day, are essential. Look for patterns over a week before making any adjustments. If you notice fasting or overnight hypoglycemia, reduce your basal insulin by 10 to 20% right away. When adjusting, focus on one change at a time for accuracy. Carb-free days can help you fine-tune your daytime basal insulin. Use fasting glucose levels to guide your bedtime adjustments. If you find yourself needing frequent correction doses, it might be time to tweak your insulin-to-carb ratio or adjust your basal insulin. After consuming alcohol or exercising, consider reducing your evening basal by 20 to 50%. And remember, do not correct high sugars after a hypoglycemic episode. It can lead to more fluctuations. If post-meal readings are high, increase that insulin-to-carb ratio. For those recurrent unexplained nocturnal hypoglycemias, lowering your bedtime basal insulin could be the key. Always consult with your doctor before making any changes to your insulin regimen. Stay vigilant and in control.